Hi, my name is Janice Schwartz. I've been a licensed massage therapist for over 22 years. If you're suffering with lower back pain, I've got some really important information for you. You may be surprised to learn that the pain you're feeling is not originating in the lower back, but in the deep muscles in the front of the spine. These can be reached through the abdominal area. This is the front of your spine in your lower back. This muscle is the psoas muscle, and that attaches on not only the vertebrae, but also the discs. It joins with this muscle here, which is called the iliacus, and together they form the iliopsoas. When the psoas is tight, it can cause pain in your mid-back all the way down to your lower back. If it's tight on one side, it can cause the discs to bulge out on the other side. If it's tight on both sides, because there are two sides, obviously, it can cause the discs to bulge in the front. My client Kathy's been complaining of some lower back pain, so I'm going to demonstrate what I would usually do for someone who has this complaint. First, I would start with the iliacus, which is the muscle that goes behind the hip. So I'm just going to go right in here and go along the muscle and across the muscle. Is that tender at all, Kathy?
Yes, it is.
Okay. So normally I would stay on this muscle for 8 to 12 seconds until the discomfort diminishes. But for the sake of this video, I'm just going to move along. So then I would move down to the next part of the muscle and work on that, and then a couple of more spots here. I see you're flinching a little bit, so that's a little tender. And I would stay here on each part, as I said, for about 8 to 12 seconds. And then now I'm going to go in and work on the psoas, which is the deeper muscle that attaches right to the spine on the vertebrae and the discs. So I need to go in a little deeper here because you have to get through the abdominal muscles and you get down past some of the organs, right to where the muscle attaches to the spine. Is that tender?
No. Yes, it is, a little bit.
Okay. And then again, I go across the muscle and then with the fiber of the muscle. And normally I would stay here for 8 to 12 seconds, which is about the time that it takes for the muscle to release. And then I would go further down the muscle. And this muscle is a thick muscle. It can be as thick as your wrist. And it's also a long muscle. So it goes all the way from this area here down to the inner thigh. And I'm not going to do the whole muscle now, but you get the idea. And then I would go to the other side and I would work on that side. And then if the muscle was really tender, I would come back again because the circulation now would have had a chance to get into the muscle and loosen things up. And so I would be able to get in and loosen it up even more. It's kind of like peeling an onion each time you get another layer. So after doing that a couple of times, the muscle's going to be nice and loose. And sometimes that's all that's necessary to get a big result in reducing back pain. If you come to see me with lower back pain, I would then go on to work on the front of your legs, the back of your legs, the glute area, which can also be involved, and the lower back. The iliopsoas is just one area that is often overlooked but is extremely important to address when looking for the cause of low back pain. I'm going to have Kathy demonstrate a really wonderful stretch for that muscle that I just worked on, the psoas. So Kathy, I'm going to have you lie on your side with your back facing me, right on the edge of the massage table. So good, your bottom leg is already bent, so you're going to bring your top leg off the side of the table and just let that hang, and then you're going to reach diagonally with that arm. And that gives a really good stretch to that psoas muscle, which is right in here. And this is a great stretch to do if you're feeling any lower back discomfort at any time. You could do it a couple times a day, you could do it in the morning, you could do it in the evening. The only thing is, if you start to do this and you feel discomfort, then just stop. Don't do it. And then after you stretch this side, you would go ahead and stretch the other side.